of PowerPoint slides here that I'm going to share with you. And we're going to talk a little bit about laughter and physical well-being. The reality is that laughter can actually have effects on every single one of those 6 elements of lawyer well-being that we're discussing this week. And I'm not saying that to like blow myself up, but I'll be showing you some things that actually help us learn that. So first of all, the things we need to know are, we hear wellness and well-being being used often, and they kind of mash together and seem to mean the same thing. So there are some subtle but important differences. And what I've done is I've used some government definitions, and this is from the National Institute of Health, that wellness has several dimensions, including emotional, coping effectively with life and creating satisfying relationships, and the physical, recognizing the need for physical activity, healthy foods, and sleep. So you might think that's the only definition we need. Unfortunately, in many places, wellness has only been focusing on physical wellness. You'll have a program from your employer, maybe. They'll pay for you to go to the gym. They'll take your blood pressure. They'll check your cholesterol. So bringing in well-being into this as a separate entity is really important, because well-being includes the presence of positive emotions and moods, including contentment and happiness, the absence of negative emotions, as John spoke about, depression, anxiety, but most important is satisfaction with life, fulfillment, and positive functioning. And here is really an important thing to remember. Wellness, as in health and physical health, is fleeting. You may have, as I do, a chronic condition. So wellness day to day is not always assured to me. However, well-being you can have on a day-to-day basis if you practice some of the things that John and Nicole both talked about. And I'm going to also explain how laughter plays into that. And having a high level of well-being helps you build your resilience for when life is not so funny. So the science of laughter tells us that laughter existed before humans had language. This is such an important part of human existence. It's based back in your primitive brain. And as the brain develops from front to back, laughter is something you encounter at a very young age. And I'm going to talk a little bit more about that. But imagine 2 groups of Neanderthals meeting each other in the rainforest. They have no language. They use some signs, something to try and get along with each other. And very often misinterpretation could end up in a fight. So the human brain developed this weird kind of thing with the face, making this expression with your teeth and your lips, a smile, and also adding onto it some kind of funny sound, ha, hoo, ha, he. And this is what started off as the origins of laughter. Nothing was funny. No one was telling jokes. It was to show I'm friendly, we can get along, and we can get over this barrier we have that we can't communicate with each other. So this is so important that there is a diabolical reason why babies laugh. Now, when I was a young mother and I told the doctor, wow, my baby is smiling and laughing already, she's only 3 months old. And the doctor would always say, oh, that's gas. Well, it may be gas sometimes, but we now know through functional MRIs that babies actually laugh because they are using that primitive social bonding technique to bond with humans, other humans, to make sure that they're cared for, loved, changed, taken care of, increasing their chances of survival. We now know from a functional MRI that if you're holding a baby, looking in the baby's eyes, smiling, maybe laughing, that your brain waves and the baby's brain waves sync together. And you think, of course, I'm the adult. I'm teaching the baby. And that's not true at all. The baby is syncing your brain waves to itself. Again, to pull you in, to feel bonded, to feel responsible, to ensure that baby's survival. That's why I say it's kind of like baby mind control, very diabolical. So there are three laughter well-being pioneers that we often talk about in the Association for Applied and Therapeutic Humor. And the first is Norman Cousins, who was the editor of the Saturday Evening Post. For the young people in the audience, that was like a paper thing that people would get and read from it. They weren't able to read it on their telephones. And he wrote a book called Anatomy of an Illness, based on the fact that he had a doctor who said to him, "I'm sorry, Norm, you have this XYZ thing wrong with you, and you need to get your affairs in order." And he decided if that's the way he was going to go out, he was going to go out laughing. He asked all his friends in Hollywood to bring him funny movies, comedy shows, things like that. And he found that 20 minutes of hearty belly laughing gave him enough pain relief to have 4 hours of unbroken sleep. He eventually did not die of whatever this was he was diagnosed with, lived about 40 years more than that. And his book started the whole science of studying laughter as an absolutely necessary survival mechanism for humans. Many of you know Dr. Patch Adams, as he was played by Robin Williams in the movie. He actually runs the Gesundheit Institute in Virginia, and every year he takes willing volunteers with him around the world, not only to do medical work for those who can't afford it, but to bring laughter to them, because as he has found out, using laughter in medicine raises the outcomes. Cancer Treatment Centers of America, who at one time gave me a scholarship to go to AATH, has this right in their buildings. They have a room where you can go in and have laughter therapy, do laughter yoga, other laughter things, because they know it helps outcomes because you're taking care of your well-being. And then there was Dr. Kataria. Let's bring him back. Dr. Kataria is a doctor in India, and he studied Dr. Adams and Norman Cousins and decided, if I can get my patients to laugh, it can help them physically and mentally to have better mental and physical health. So he decided to take all his friends into the park in Mumbai, and we're going to tell jokes to each other. So they told jokes to each other before going to work in the morning, and everyone laughed and they felt really good. And they reported to the doctor, I think I had a better day because I laughed this morning. Well, the second day wasn't so funny. Third day, maybe they were telling puns. By the fourth day, they might have been really telling really risque stories. And Dr. Kataria realized that I can't maintain this joke-telling comedy thing every single day in the park. And he developed what is now called laughter yoga, not because there's posing or mats, but because pranayamic breathing is used in a way to simulate and stimulate laughter without relying on jokes and comedy. So the advantages of laughter are it benefits both your physical and psychological health. And even pretend laughter convinces your brain to release feel-good endorphins. And laughter will boost your resilience for those times when life is not so fun. There was a study done not too long ago, and it's still being parsed out as to whether the exact numbers are correct, that for every negative thing you have happen in your life, you need at least 3 positive things to balance that out for your well-being. And this is why sometimes we feel like, I can't get out from under. The hits keep coming. It's one thing and one thing and one thing, and you just can't seem to get out of it because the unpleasant, unhappy things have a tendency to have more weight than the more pleasant things. My favorite source for medical information is the Mayo Clinic, and here they break laughter down into both physical and psychological benefits. Laughter enhances your intake of oxygen-rich air, stimulates your heart, your lungs, and your muscles, and increases the endorphins released by your brain. It relieves pain. We are finding that laughter may ease pain by causing the body to produce its own natural painkillers. It also is a cross-brain activity, just like running, which often can push stress, pain, and other things to the back of the brain where it's not so prominent. Laughter can soothe tension by stimulating circulation, easing muscle relaxation, and help reduce the physical symptoms of stress, which affect your mental health. So it also psychologically can improve your mood, increase personal satisfaction, and on both sides of the equation, it improves your immune system. Negative thoughts do manifest into chemical reactions that can affect your body by bringing more stress. That's the famous now level of cortisol that you're having. So positive thoughts can actually release neuropeptides that help fight stress and potentially more serious illnesses. And the thing is that, again, we're talking about building up your well-being because you may not have wellness, but how you're dealing with it is going to help your overall attitude and your feelings, and in a lot of ways help reduce pain. The American Heart Association actually has a part on its website where it talks about laughter and the heart. The physical manifestation of laughing gives your heart an exercise. Now, we know that in some exercise we talk about being on doing cardio. Laughter probably is not cardio for most of us, but it is aerobic. We are breathing deeply, we are exhaling and inhaling. Sometimes we actually lose our breath, but again, the heart rate goes up. And I often challenge people when I'm in a laughter yoga session to take their pulse, because even seated, you can see a 20 to 30 point rise in your heart rate just from doing laughter. And I just wanted to show you that the Association for Applied and Therapeutic Humor, the people who are serious about laughter, they encourage their members to do studies. And one of the ones that was done was adding therapeutic laughter to a cognitive behavioral therapy, mind-based, and rehabilitation, body-based, program for chronic pain patients. And these things are still being studied, but the pain psychologist, after the first session, remarked about one person, "I have never seen that patient so animated." And he was referring to a chronic pain patient who suffered from clinical depression and normally presented a flat affect. And that content has now been offered regularly since May 2013 in their chronic pain clinic. So I'd like to leave you with a very quick Laughter for the Health of It exercise sample. And remember, it requires you to breathe using yoga pranayama and trying to laugh, not because any comedy or jokes, but because you're going to do it as an exercise, and moving a little bit. And as we're seated in our chairs, the amount of movement we're doing may just be raising our hands or something like that. But the first thing we have to know is what a pranayama breath is. It is in through your nose, and join me with this. In through your nose, then out through your mouth forcefully. Now, the way you do a pranayama breath and laugh is you breathe in through your nose, and when you breathe out through your mouth, you forcefully say one of the laughter sounds. Ha ha ha, ho ho ho, he he he. Let's try that. Breathe in through your nose and laugh out your mouth. Ho 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 ho. All right, that is a laughter sound. Your brain says, okay, you're laughing, release some endorphins. So let's just try that one more time with a different laughter sound. Breathe in through your nose, laugh out. Again, let's try it with the third laughter sound, which is he he he. Breathe in through your nose and laugh out. So The very simple way you can do this in your law practice without everyone up and down the hall looking at you like we're very serious people doing very serious work. There's no laughter in this office. You can close your office door. You can put your hand in front of your mouth like this, and you can do a very quick laughter exercise in silence. You must feel your breath hitting your hand, and that tells you that you're breathing. So, and we use the words ho, 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 ha, 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 he, and we do this. Join along with me. Ready? Breathe in. You do this for a minute or 2 minutes, you are raising your heart rate, you are sending endorphins throughout your body. It's especially great when you've been sitting at your desk all day over something that's mentally taxing you, and now you have to get up and go to a meeting, or you have to go to court, and you need to be on your A game. You do a little bit of this, it really refreshes you. And if you're more interested in this kind of thing, I encourage you to look up laughter yoga and laughter wellness on Google, and you will find programs and videos all over the place that can help you do this for your body. And I hope that is helpful to you. And this again is a quote